Peritonitis fluid sample collection procedure. If you receive a phone call from a doctor or a verbal order or a written order to collect peritonitis protocol samples, you will have to go to one of our units, L2 or B7, to find in a dedicated location a peritonitis protocol kit. The kit contains everything you need to obtain peritoneal fluid samples, culture bottles, cell count, gram stain container, supplies to obtain samples, as well as the chart which shows you in which order to obtain the samples. Before you go to the floor, you will need to print your labels and take them to the floor or emergency room or wherever the patient is. You'll go on Oasis and order peritonitis protocol peritoneal fluid tests. Also, it's a good idea to bring a bag of peritoneal dialysate fluid with you in case the patient is empty. When you arrive at patient's bedside, identify yourself and identify your patient. Clean the surface to be used to procure the samples. Wash your hands according to the hospital policy, and proceed with the patient's assessment. Assessment will include taking vital signs, taking temperature. If the patient has a fever, make sure that the blood cultures have been done earlier, and also start draining. Proceed with the manual exchange to obtain the fluid to procure the samples. Once you have your peritoneal fluid that was drained and that has been in the abdomen for at least 2 hours, proceed with taking samples. As per order on the chart, green. Of course, disinfect your port with alcohol. Green. Okay, then orange.